Welcome Graham for his third edition. For those who have been online before and witnessed Graham's last two presentations, Graham is a very well credentialed former physician who has both Australian skills and knowledge, but also overseas knowledge as well, and has a vast understanding of medicine, and we look forward to his presentation. So I'll hand over to Graham at this point.
Thank you, Chris. I'll pay you later. So this is the third talk I'm doing here. The first one was really to introduce the concept of how complementary or herbal medicine subsequently split from what we would now call orthodox to some extent in different pathways, now perhaps less obviously so than they used to. And then the second one was specifically about cancer therapies. And this one is really, I'm always concerned, and Chris and I were talking about the vast array of books that are here. There are enormous numbers of books written about natural therapies nowadays, a lot of them contradictory. And my focus has always been in my travels to try and find natural therapies where actually have proof of benefit rather than wishful thinking, which is often the case. So this goes back to really the sort of early days of industrialization. I think people know Charles Darwin, the man who's named just about every plant there is known to man, and his theory of evolution. His father was a minister of the cloth, and probably his father was actually the fundamental individual who started Charles Darwin in terms of his exploring and working how plants and animals developed and came together. And he was also a minister of the cloth, and you can see at that stage in the game, medicine was really not a very good place, and there was a lot of superstition. He's described witchcraft, hobgoblins, vampires, fairies, all sorts of things, and then signs in the sky and so on. All these things were thought to be foretellers of good or bad fortune or good and bad health. And to some extent, there's still quite a bit of that wishful thinking goes on. And you can perhaps put in the modern era examples like this, which I'm not sure whether they're involved with CanSurvive, but there's certainly a lot of mumbo jumbo involved in some modern alternative medicines. And I think it's a little bit scary when you have a potentially life-threatening condition like cancer that people may be distracted into alternative areas. So what I'm going to do this time is I'm going to run through a little bit of background chat and then going to look at the natural therapies which I think have proof of efficacy and finish off with that. Not specifically cancer therapy. So this is the problem with any modern or traditional medicine. It's how it's sold. The placebo effect, I please, is the Latin word, and how it's sold is how you expect it to be more or less effective. And as I've said there, even colors of pills can make the difference between there being more or less effective. So placebo effect, even in this modern era, is still very much part of the story. So to my mind, this is the way we're currently at with natural therapies in the orthodox world, and you can see some of them are recognized, some of them patently not. And I think particularly if you have a condition like cancer, then it is important to stick with those treatments that have some sort of runs on the board. And I'll go through some of these in a little bit more detail now. This is one I came across just recently. I don't know if you've heard of this, the Wim Hof breathing method. He was the man who was able to descend down to however deep it was and stay down there for several minutes underwater without any support. And he developed this breathing method, which sounds a little bit of a sort of Mickey Mouse type thing, but actually, when they've actually looked at it in more detail, there does seem to be some evidence that this sort of breathing method alone can have some physiological changes to your body. And quite a lot of studies have been done, including in Queensland just recently, finding that the breathing method itself lowered stress, boosted energy, enhanced mental clarity when practiced consistently. There is the clue, of course, you've got to do it regularly. And there are also changes in the laboratory testing which suggest that it's having some effect as well. So there's some scientific basis to it as well as the practical outcome. And who knows what other wonderful things we will come up with. But this is an example of what could be called modern medical therapy, which has produced nothing but disasters. So in the early days, when radiation was first being developed with the Marie Curie and her husband in France, and she eventually died of cancer because of the radiation. Radiation was thought to have wonderful curative properties. So we now know that that's in fact the opposite effect. Bloodletting was also a wonder cure for everything in the old days, removing blood, removing the poisons. And it's, as I've put there, just over bloodletting contributed to President George Washington's death. He was bled to death, sort of thing. Another one which has come and gone, I don't know whether it's still used in your therapy or not, pyrotherapy, heating people up in baths. The idea being that the heat actually killed the infection or whatever it was, rather than the patient. And obviously sometimes it killed the patient instead. But it was particularly used in the old days before there were adequate antibiotic therapies available. And one of those classic examples was the wily spirochete syphilis, the venereal disease. And obviously if you had that and there were no active treatments apart from fairly poisonous things like arsenic, then that was one of the cures that you took. In more recent times, shock therapy, electroconvulsive therapy is ECT. That was a shock treatment, and insulin treatment used to lower the blood sugars to produce a shock. This was for a period used to treat madness in people, again with no real evidence of benefit. I'll talk a little bit more about things that go up the bottom, but that was the wonder cure of yesteryear. Tobacco smoke going up your bottom. Now, I'm not quite sure how you get the cigarette alight or whatever it was, but anyway, there's some examples of strange cures that have come into orthodox medicine that have come and gone.
Say that AI blows smoke up my backside.
Yes, well, I'm sure there's a bit of that going on, yeah. And in modern times, stem cell therapy has been the wonder cure for everything, and it's really been a hugely disappointing treatment, although they're now using some alternatives using placental blood, so embryonic stem cells, which maybe have more potential for future development. I briefly mentioned color therapy, and there is no doubt that in simple terms, the different colors affect you in different ways. So green is a relaxing color. Yellow can improve your mood. Orange can make you happier. And as I mentioned, red particularly can improve your strength and well-being. And this is well established, particularly in Chinese medicine. And this is just an example of a study that looked at a group of men's strength, their ability to lift weights, depending on what color they were looking at the time. And the conclusion was that, the conclusion was, gone the wrong way. The conclusion was that when you were looking at a red wall, your strength was much improved compared to looking at a blue wall. And so who knows these things that the mind does to us that we're not really aware of. Iridology is one of those things which still survives the passage of time. And this is a chart which theoretically shows the different parts of the body on the iris. I don't know that anywhere there's been any proof of benefit with this sort of medical approach, but it's still around because it's been going for long term. And I mentioned smoke up the bottom. Colonic lavage is one of those treatments that affect a certain group of patients, I suppose. This is from our local clinic just down the road called Bottoms Up Clinic, which is an appropriate name. And I thought, I'm not quite sure whether the all the rest of it that went with their advertising blurb, I'm not sure if the gubby country traditional custodians would approve of them being roped into having things put up people's bottoms, but that's the way they advertise it, and who knows.
The heading lets you in and you think, what, bottoms up? Well, after all, when you have a
Indeed. So this is theoretically what colonic irrigation is supposed to do, apart from obviously improving your bowel function. It does all sorts of other things, purging the liver, getting rid of parasites, improving your immunity. There is absolutely no evidence of benefit whatsoever for this treatment. Maybe Ian will disagree, but my understanding is that it is now being superseded to some extent by the slightly more palatable things like taking things like by mouth with probiotics and prebiotics and so on. And I have actually seen in children, I've seen children being made significantly ill because people tend to forget that fluids and electrolytes can be absorbed at the top end and the bottom end. And if you put the wrong constitution of fluid into the bottom end, it can actually alter your blood chemistry. And in a child, it can actually cause significant illness. So not as all as it seems. Now, aromatherapy is an area which I think does have some significant benefit. And you can see here, this is a side view of the head. This is the olfactory bulb here, which is, as you can say, intimately connected with the front part of the brain. And just here is the nose. So logically, any chemicals that are in this area very rapidly get absorbed and very rapidly get into the brain. And there's quite a lot of evidence of aromatherapy being effective for a whole range of conditions. Stress, particularly, nausea, a number of inhaled options. These are traditional therapies, and I think do have some sort of significant benefit.
It's hard to do a double-blind placebo-controlled trial on it.
Well, it isn't really, is it? Not really.
You can smell it or you don't smell it.
Well, there are options available to do the double-blind part of it. Yeah. Anyway, diets are. Any ladies' magazine you look at nowadays, you'll have a new diet every week, and there's a whole swag of diets, and some of them, the old Mediterranean diet, has stood the test of time with plenty of olive oil and vegetables and red wine, and there are a whole range of others, far too many to mention, and a new one comes every week. The problem with these fad diets is that they may be enforceable for a couple of weeks, but you can't spend the rest of your life eating diced carrots or whatever it happens to be. I like the red wine bit at the bottom though. That seems to help with a lot of conditions. So nowadays we're into the heavy-duty supplements market. This has now become enormously valuable for the pharmaceutical companies nowadays. They all have their labels which suggest that they may be alternatives, but they're all basically coming from the big pharma, and increasingly with advertising, it's this example here, 50% of US adults consume some sort of supplements. And the question is, A, can you afford it? B, is it making you better? Or C, might it actually be making you feel worse? And there are some examples here, for example, of overdosage with things like vitamin C or vitamin D, which can actually make you worse. And so the fundamental to this whole thing is the healthy diet that you start out with rather than supplementation. Peptides at the bottom I'm going to talk a bit more about, because this is the latest craze in natural therapy, and I'll mention a little bit more about that. So this is actually from a clinic down in Brisbane that I went past a while back, and just shows you the sort of selection of things that they're claiming to cure: stress, anxiety, mood, immunity, detox, whatever that means, allergies, women's and men's health, adrenal exhaustion, who knows what that is, thyroid conditions, skin conditions, and so on. So they claim to cure basically everything. And I think it's a little bit scary that the power of advertising is what's selling a lot of this stuff. Snake oil salesman on the right there is of yesteryear, but the science, or the pseudoscience, is the same nowadays. There are scientific sounding words which are used in the advertising. They use really meaningless words like scientifically or clinically proven. Doesn't mean anything. The testimonial side of things, particularly from some high-flying individual, and then there are also problems I've mentioned further down, and that quite a lot of Chinese medicines actually contain a whole range of other things in them, like anti-inflammatories, sometimes even steroids, to make sure that they work. So be careful what you're actually using. And I mentioned there, it's one thing using something on a short-term basis, but if you're looking at it as a lifelong supplement, then the risk of complications developing are significantly more. This is an example. I don't probably the ladies know this, the Fountain of Youth, and this is all collagen supplements that do all sorts of wonderful things to your skin and to your body as well, apparently. But this is the power of advertising, and the power of advertising is the same as it's ever been. So it was described by somebody years ago as advertising encourages people to buy things they don't want with money they haven't got to impress people they don't like. And that, to my mind, just sums it up. And it's the same forever. So probiotics, big stuff nowadays, and a whole range of different varieties of bugs you can shake that apparently cure all sorts of things. Probiotics, and then we get into prebiotics and probiotics. All these things sound suitably scientific, but with
prebiotics.
Indeed, you may well ask. I've got no idea. It's maybe Ian can answer that one, can you?
Prebiotics supplements that put in your gut that are like fertilizer to the microbiome in your colon.
The old microbiome, that's the one, isn't it? Yes. And
there's thousands and thousands of research articles on changing microbiome.
there are thousands and thousands of different recipes and thousands of different wonder solutions, apparently. Now the one at the bottom there is particularly unpleasant. You would think fecal transplant, having somebody else's poo in capsule form for you to consume, but it is actually
Clostridium difficile.
Yes, that's right, Clostridium difficile. So that's for a particular rare and very damaging type of diarrhea, which can clean your gut out completely. So
3 cases in the last 10 years.
Yeah. So in my first talk, I discussed how what I would call orthodox medicine differentiated from alternative medicine, and that was in the 19th century with manufacturing and the ability to synthesize different chemicals. And the other advantage, of course, that it was able to standardize the product you're getting. And this compares with where we were with plant medicine, natural medicine. Estimated, I'll read it, it's probably a bit small, 250,000 flowering plant species, and something between 50 and 70,000 have been used in different parts of the world in medicinal approaches. So there's a lot still to be discovered from natural medicine, but because it comes from natural medicine doesn't mean that it's harmless, and plants can kill you. And it's just a small example I put at the bottom, just from the small area of Europe in the Balkans. Serbia, 700 different species, Bulgaria, over 700, Romania, same sort of number, and Montenegro. So in a small area, there's probably something of the order of 3,000 plants being used medicinally. So there's just difficult to confirm their effectiveness. So this is old school medicine of yesteryear. I talked a little bit about it in the first talk. The monasteries in Europe were in the European terms anyhow, were the foundation of medical knowledge. They had the ability to write, they had records, and they also had gardens to grow things in. So a lot of the medicinal treatment of that era came via the monasteries. And this is an example I've got here of different plants, which some of them which you all know. And the reason for selecting this different lot, and I've only put 11, there are 24 different plants with a Latin name which has officinalis or officinalian, and that's the traditional room in the monastery where the medicines were mixed. And some of these are very much in evidence. Goat's Rue at the top, for example, Galega officinalis, is a source of a medicine called metformin, which is very much an important medicine for the treatment of diabetes. Ginger is undoubtedly of evidence in various forms of nausea, including in pregnancy. Sweet clover is used for menopausal symptoms. Valerian is used as a moderately effective anxiety cure. So some of these have stood the test of time from going back hundreds of years, but we have to make sure they do prove the test of time. For average illness, rather than long-term illness, the standard intercurrent illnesses, most of these conditions will get better with time anyhow. So whether you take something or not, you'll get better. And if you're taking something, there's a natural assumption that whatever you're taking has made you feel better. So in short-term usage, there's not really so much of a problem. It's really when you get into long-term usage of conditions that there's potential for problems to develop. But starting off with that original thing about snake oil medicine, this was nearly 100 years ago. The US Surgeon General wrote this article about the power of advertising of even 100 years ago, how it could be used to encourage treatments that were not actually effective. And as I said there, nothing has really changed. And if there is an alternative medicine that's proved to be effective, like metformin, for example, then it becomes adopted into orthodox medicine because it's proven. So how did we get going? Well, traditional cures, there was no real knowledge of what caused disease, no knowledge of how infections work, no knowledge of cancer, all these other conditions. So it was basically accumulated knowledge over trial and error. And the difficulties with that is, even if you know that a particular plant will have some beneficial effect on a condition, how do you know that that plant picked in the morning or picked in the evening is going to have the same strength of potency? How do you know that you can store it and it will still work weeks later? So a lot of problems with standardization of natural therapies. And so when modern medicine developed, really in the 1800s, they were able to find out what the cause of disease was, what was going wrong with the body, and then specifically find something which made a difference. Obviously, initially starting out with primarily plant medicines and then looking at the chemical constituents of the plant and finding out which specific chemical was effective and then manufacturing it. And the reason that modern medicines are expensive is because clinical trials are very expensive to run. You start off with the laboratory, seeing if this particular chemical will have some effect on the cells. Then you go to animal testing, and then you go to the first stage human tests where you actually have to get an idea of the dosage that's required to produce the effect. Then you go to the next level when you're looking for side effects. And finally, you do what are called phase 3 studies to compare treatment with placebo. And that's very expensive to do, and that explains why a lot of pills are pretty expensive. I think the current going rate for everybody wants a pill for obesity because nobody can eat less, and the GLP-1 chemicals which reduce your weight costs an estimated 5,000 a year. And they obviously, people don't want to eat less, they want to have the same lifestyle, and they want this drug put on the PBS, which would bankrupt the country, never mind the PBS.
It already is.
It's limited available for people with certain medical conditions as well. But if it actually went across the board, when we know that a third of, well, 2/3 of modern Australian adults are overweight and a third of them are obese, the cost of this sort of thing would be astronomical. So how can we move on to the connection between orthodox and alternative medicine? Ian would have read about the Cochrane collaboration, which has been going for 20, 30 years, looking at different clinical trials all over the world and trying to put them together into proof of some scientific proof that things do work. I've written down one or two other problems there, that if a medicine doesn't work, if a plant or an orthodox medicine doesn't work, they don't tend to write up a paper saying that it doesn't work. So the negative side of the equation is just as important as the positive side of the equation for effectiveness. So that tends to get wiped out. Vested interest from drug companies, and I was talking about the politics with obesity at the moment. Then if you have more than one condition at the time, how are the various medicines, whether they're orthodox or alternative, how are they going to interact? And finally, and I'm sure Ian's seen this all the time, you've got elderly people who are in their 70s, this is an example, who've got a raised cholesterol, and do they all need to be on pills when you've actually proved by your own existence, the 75, that it's actually not a great risk for you? And the commonest treatment for cholesterol.
Risk anyway. The whole thing's a myth.
No, I don't know about that. I think there's a lot of
it is.
Well,
and I've got 4.
No, but thank you, Ian. Yes, but the fundamental thing is these clinical trials have been going on for 30 years. Statins do work, and if you want to bring it back to natural therapy, the original statins came from fungi, so there is an overlap there too. So this is an example of the sort of work that the Cochrane Library does. Chronic hepatitis B is very common in some parts of the world, particularly in Asia. And so this was a trial looking at a traditional Chinese medicine for liver disease in association with this chronic virus infection. As there are now alternatives available from orthodox medicine, it is difficult to support this sort of approach. It's got a traditional history, but when the runs are on the board with comparing it with something else, it doesn't come up. Another example with looking at treatments for diabetic neuropathy, pain in the nerves, pain for arthritis. So the Cochrane Library has gone through all these thousands of trials worldwide and tried to put them together into one big package to try and prove some benefit. So here are some things that we do know work coming from plants. One of the early treatments of heart disease was with the foxglove, Digitalis purpurea, still used to this day. Digoxin is still used. In some parts of the world, in Europe, they tend to use another plant called hawthorn, and these plants have what are called cardiac glycosides in them, stimulate the heart. And so that's where the overlap between alternative then becomes orthodox. Peripheral vascular disease, there are studies using something, ginkgo biloba, which is a relatively well-known herbal treatment, which improves the it's pain in the legs if you walk and your blood supply isn't sufficient, so that does improve the circulation to the legs. Varicose veins can lead on to skin problems, varicose eczema, and another extract of horse chestnut seems to calm that down. Cholesterol, apart from the statins we were talking about there are other natural therapies which do seem to have some benefit, and the same with high blood pressure. So there are things that are around, and if we can look still further at what's been proven, so many people nowadays seem to have a condition called irritable bowel, which seems to be increasingly related to food allergies, which are everywhere now. So peppermint does seem to calm that down. Ginger, I mentioned for vomiting, for seasickness, particularly chemotherapy, it's used after chemo, and in pregnancy because it's safe to use in pregnancy. In dementia, again, with the same medicine, ginkgo, improving the circulation to the brain. Kava, have any of you guys ever tried kava? It's a Pacific Island root of a related to the pepper family. And having lived in Vanuatu, I used to be the weekend equivalent of going to the pub. And the only problem is that kava looks like mud, it smells like mud, and it tastes like mud. So you have to get it down you, and then it's quite a pleasant calming effect. I think I prefer to stick to a few beers personally. Oh, the red wine, yes, indeed, indeed. St. John's wort in depression, again, that's got some evidence of benefit. Echinacea, a little disappointingly, it's still promoted as an immune stimulant, and I think there's really some doubt as to its efficacy in improving the immune situation, whether it's with an infection or even with a cancer treatment, and some concerns that it might adversely affect cancer treatment as well. Anyway, there are a few examples there of things that have been shown to work. Some more. This is my favorite, the extract of the autumn crocus, Colchicum autumnale. Having been taken in the toe on a few occasions with an attack of gout, I know that it's colchicine, which is the orthodox equivalent, is the most rapidly effective treatment for an attack of gout. Saw palmetto is it's a palm type plant that has been used to treat benign prostatic hypertrophy. Evening primrose oil for premenstrual tension, feverfew for migraine, ginseng. Surprisingly, it's still difficult, despite its long history of usage for a whole range of Asian conditions. It doesn't seem to be easy to prove. In Europe, mistletoe is used as a cancer treatment, although not in the West in general. So as I said there at the bottom, the problem is that there's lots of money to be made from these plants, but if you actually prove that this sort of treatment is effective, then it's very difficult to patent the product to get your money back. So clinical trials tend to be lacking. So what's going on? Well, America leads the world. As I said, half of adults take some sort of supplements without really any obvious benefit on chronic disease. Here's a few examples that might possibly have some benefit. Fish oil, calcium, vitamin D, glucosamine, still not proven. Big money, as you can see there, 2.4 billion spent on supplements. And there are some potential downsides, as I've listed there. Maybe an increased risk of stroke with vitamin E and increased risk of cancer with too much vitamin. This is something I came across just recently. I'm just showing this because it's of Australian interest. There's a product which has been developed for the treatment of arthritis. Historically, there have been effective treatments of arthritis using an extract from the combs of chickens and using that as an injection into the joints, and it does seem to help. These guys in this research thing in Western Australia showed that extract of pearl, also not the I don't think the actual pearl itself, but the shell of the oyster could be used and maybe has some effects in terms of arthritis control as well. I can't remember what, oh, that's right. It's called the nacre, N-A-C-R-E, of the oyster. I remember first of all coming across that sign when I lived in Bundaberg, when I first come to Australia, and there was a sign up outside somebody's property saying for sale half a nacre. So a little bit of education required there. So this is gradually increasing and increasing, and big money for big pharma made from these. Just some examples of, as long ago as 40 odd years ago, a lot of nurses were using vitamin supplements, and by the more recent times, even more of them using herbals and dietary supplements. 150 billion. A lot of loot, and what is it actually achieving? That's the question. Even in Australia, you can see the advertising has gone through the system, and both in the health system and in the public in general, the use of, all you have to do is go to the supermarket and you'll see that the shelves are stacked high with supplements of various sorts. So this is just one example of how things might not work as anticipated. Some side effects from taking excesses, omega-3 fatty acids and folate could reduce the risk of cardiovascular outcomes. That's good. Combined calcium and vitamin D might increase the risk of heart attack or stroke. And so it just because it's natural doesn't mean it's going to do you no harm, never mind do you good. Red Bull, caffeine is everywhere nowadays. Every corner seems to have a coffee shop. How did we get by before coffee came on the scene and it was just having a nice cup of tea? But caffeine is everywhere now, and as more and more people take it in more and more different ways, then the question is, what is an excess of caffeine going to do to you as well? Protein drinks are now really big business again too, and the question there is what they actually do to them. Excess certainly can make you antisocial with bad breath and gut problems and kidney damage. And pyridoxine is one of these wonder cures for all sorts of things nowadays, and we're now getting to the situation where it's being put into, that's vitamin B6, being put into so many alternative substances that there are people starting to get overdoses of vitamin B6 causing nerve damage. So again, balance is the right thing. Magnesium is one of my old favorites, and Ian would remember from his hospital days. It's a very useful treatment short term. If you're having trouble controlling an irregular heartbeat or high blood pressure, or the vomiting in pregnancy.
Pacemaker instead.
I don't think so.
Yeah,
Or epilepsy uncontrollable, or asthma uncontrollable, then intravenous magnesium can be of benefit to settle it down. Long-term usage, different thing, and it's used now quite widely. There are shops that do nothing but use magnesium. Peptoids, I started to allude to. These are breakdown products of protein, and typically 2 or 3 amino acids joined together. There are heaps of them, and it's the first and most well-known one is insulin, obviously, which everybody has heard of for treatment of diabetes. But there are many now being manufactured, and they claim to have all sorts of wonderful benefits. If you actually look at the ones that are available in this country, there are very few and very limited applications. But if you go online with the social media, you can find hundreds. And when you get your delivery from overseas, you will find it says at the bottom, not for human consumption. So you pay your money and you take your choice. But with the bodybuilding that's now part of the young people's philosophy, peptides, creatine are all very much part of their modern philosophy. So it's big money. And what the question is, what is the long-term consequence of using these things? And nobody knows. Over the course of, that's starting out in 1900 there, when I first started in medicine, life expectancy was about 70, and now it's around the 85 level. And Australia fares pretty well up until now in terms of the life expectancy stakes. But the reality is that countries like UK and US and now Australia, the life expectancy is starting to go backwards. And this is primarily obesity related. And so there are other things that could be suggested, like environmental pollution, a whole range of other things which are in our diets and in our environment, which never used to be. But fundamentally, I think it's the weight loss which is causing the decline. And these are the two modern epidemics for old people. And in the old days, it used to be as simple as just getting a tape measure, wasn't it? And you measure your waist to hip ratio, and that was it. Then that was how you managed the condition. Nowadays, you have to have all sorts of scans and blood tests and so on. Fundamental, the cure is just the same. These are some naturally suggested natural therapies for weight loss. I don't think there's any proof that any of them work. And as I keep saying, if you're taking something for a long term, then you don't know what the unexpected consequences might be. They've all got, most of those are pretty well safe and tested, but they don't actually seem to do much. With orthodox pills, there are a number of options available to everybody now. Wants the glucagon-like peptide 1 antagonists, which are expensive and effective. They're only effective as long as you take them, and once you stop them, your weight reaccumulates. And the other problem, of course, is when you're losing weight, you're losing muscle as well. And when you stop taking them, you don't regain the muscle, and the weight regained then becomes fat. So you can be worse off long term once you've stopped. And that used to be my only advice for the overweight diabetics who came to my diabetic clinic. You just need to eat your normal food and eat off a smaller plate. These are some orthodox options which everybody wants an instant solution nowadays: gastric stapling and a gastric balloon. I remember the gastric stapling coming in the 1970s, and basically what you do is you put a row of staples across so that you're limiting the size of the stomach to this tiny little area at the top here, and the rest of it goes on through. And I remember putting an endoscope down, looking into the stomach of people who'd had this procedure. And if you eat strenuously enough, you can actually burst the staples, and you could see them swinging in the breeze inside the stomach. So these treatments can be short-term effective, but tend not to be long-term. And the more drastic surgery, long-term therapy, has its own side effects. So bariatric surgery, where you bypass the stomach completely, that does work to lose weight, but it causes all sorts of side effects as well. So diet versus surgery. I'm not going to go into this too much, but the fundamental of dieting is to do it long term and not expect too much too soon. Now back to Ian's gut microbiome, and this is one of the areas that is being pushed everywhere for disease cause and disease treatment. And it's in its early days yet, and there certainly may be some evidence that long-term altering the gut microbiome may actually alter disease potential. But it's early days, and the advertising hype is well ahead of the reality that's been proven. As the population ages, and as I've written there, 6% of the population are currently over 75, heading towards 15%. That's a lot of old people lying around, not only physically incapacitated, but mentally yes. Well, I'm there. Yeah, I'm there too. Yeah. So it's really a scary thing as to how you're going to manage this situation. And we've got increasing tests which can diagnose the condition, and there are a lot of expensive treatments which really don't seem to be very effective in orthodox terms, and I don't think in alternative either. So there are a range of conditions. We're not only talking about Alzheimer's disease, but the current flavour of the month with Aussie's sporting stuff is head injuries with sports, and recurring head injuries is another cause of dementia as well. And just yes, I think that's important, isn't it? Forgetting things is not dementia; it's just getting old. Yeah, we need to highlight that. Need to highlight that one. Okay. So just a little difference here to reassure the assembled gathering. So normal aging, you can make a bad decision once in a while, making bad judgments all the time, missing a payment, problems taking care of your monthly bills, forgetting which day it is, losing track of time and year, forgetting which word to use, trouble having a conversation, losing things from time to time, regularly being unable to find things. So this is the sort of slow downward decline. And I think with so much information about Alzheimer's now, us old people are getting increasingly unnecessarily concerned about not being able to remember who we are and where we are. I love the Japanese, we were on holiday in Japan, and I just saw this example just recently. Sometimes the Japanese, obviously, are the longest living population in the world because of their healthy diet. And so they have a big problem with elderly people. There's a difference in the culture there that the elderly are normally looked after by their families, but occasionally they get loose from wherever and go wandering about, go walk about. And so they've introduced this concept in some places anyhow of barcoding the elderly patients. So all you have to do is just scan the code, you know who they are, where they've come from, take them home. Smacks a little bit of Auschwitz, but it's a sensible conclusion. Just one or two of these I'll just talk about specifically. Glucosamine has been used for a long time for the treatment of arthritis, but there is now some example of the fact that long-term usage may in fact affect your memory. So even with something that's been used quite a long period of time, there is that potential concern. So also not only worsening memory, but also in Alzheimer's group, shortened life expectancy. So again, you just never know if you're taking something long term, what the other side of it is. This is CTE, chronic traumatic encephalopathy due to too many dings on the head. And often it's only diagnosed post-mortem, and you can see the shrunken brain on the right-hand side there. And this is a big problem in sport, and I don't think there's anybody who knows what to do about it. If you've had concussion, how long you stay off sport for until such time as the diagnosis and therapy is improved, it's a big question mark. So dementia prevention, logical things, boring things, regular exercise, healthy diet, alcohol in moderation, and I may have mentioned before, how do you define moderation? And the answer is less than your doctor drinks. So if you pick the right doctor, then you're okay. Being not only physically active, but socially active, looking after any chronic conditions, and that's probably as much as you can do, apart from picking the right parents, which is obviously a bit of a challenge. But if you've got long-lived parents, then your chances are good. I've just done a little bit here about, there are a whole range of different tests that are being done to diagnose dementia. This is increasingly sophisticated, but I've put down one treatment there which removes amyloid, which buildup occurs in the brain. These new medications really don't seem to be that effective. They're expensive and not very effective. So here are some alternative suggestions. Sage and Salvia officinalis. The name sage comes from the fact that people who ate a lot of this stuff were considered sages. That's the connection with old age and being wise. And there's not a great deal of evidence of benefit from taking natural therapies or orthodox therapies for that matter. The important things to do are keep your mind active, keep your brain going, new challenges, learn a language, go to games. I was involved in a trial in the Thompson Institute, which is down the way, which was doing a study into dementia prevention for old people. And they had two groups. One group did computer games, the other group did meditation. And both activities did seem to improve the mental activity. So they're the sort of things that we can do easily. Ready Mind is one which gets quite a long mention. It's got quite a mixture of this and that in it. ginkgo I've mentioned before, and a whole range of other things as well. This combination is reputedly good for dementia and improving your mental performance. These are just small studies done over a very short period of time, but should something be proven to work without side effects, then obviously there's no alternative, so you would give it a go. I mentioned meditation. Sounds simple, doesn't it? I don't know if you've ever tried it, but it's quite difficult to empty your mind of any thoughts and just relax and think of nothing. So it's easier said than done, but certainly it does, like the breathing method I talked about earlier on. If these simple things can actually improve, give your brain a rest, if you like, and improve your brain function, then why not? It'll certainly do no harm. And meditation is part of history in terms of wisdom and so on. So
I think it's enormously valuable.
in
any healing sense, whatever's wrong
Yeah.
with you.
if you can relieve your stress, and
And it really does support
Yeah.
the system.
I think it's harmless, and it can be harm relieving. Sage, I mentioned to you briefly, this is an old-fashioned treatment we use for a whole range of other things historically, of course. So warding off evil, snake bites, increasing women's fertility. There were a whole range of attributes put to this old-fashioned English plant.
Some excitement in the healing process. So yes, that
Yeah.
sounds it.
So then applied to the skin as well: hair care, insect bites, wasp stings, nervous conditions. The list goes on and on and on and on.
Is it the particular salvia that you're in the gut?
Yeah, Salvia officinalis.
So I better start eating some.
Yeah. So whether it makes any difference to memory is another matter. That's not been proven, despite its long history, but it's certainly been used medicinally for a long time. And I talked briefly about nutritional supplements, and it's really unclear whether any supplements do have a beneficial effect. A lot of exaggerated claims, lots of preparations available through the supermarkets and what have you. At the moment, I think you have to be skeptical about whether they actually do anything or not. Now, this is getting back into orthodox medicine. I don't know if you've ever heard of telomeres. These are the little wiggly things you can see there on the end of your chromosomes. And as you get older, these telomeres progressively shorten, and the shortening seems to be associated with a whole range of bodily functions, including mental activity and fitness, resistance to infection, and so on. And the question is whether, if you can stop these telomeres shortening, you can actually prevent the aging process. And there is increasing evidence that this is possible at the moment, just with natural supplements, but they're looking at medicines to deal with this enzyme telomerase, which causes the shortening of the enzymes. So defying dementia, what do? You take up new activities. This is me on the left on the pontoon there, giving it rooty toot in COVID time when we couldn't socially distance. We had to socially distance. So me here. This old guy's in his 90s, plays the clarinet. This other guy with the mohawk haircut is actually quite normal, despite that. And we'd entertain the troops from their balconies up on high, and even passing traffic, as you can see.
Where were you there?
This is the Marucci River. Yeah. Specifically cancer, there are a number of orthodox medicines which have been derived from plants, and I've listed some here. These are relatively commonly used. Vincristine and vinplastine are relatively commonly used. I'm going to go in a little bit more detail. This is an interesting one. Who knows from which parts of nature we're going to get wonder cures. So the earthworm secretes a chemical. Well, starting point is earthworms don't get cancer. That's a starting point. They secrete a chemical called lumbricine, which is believed maybe to have some benefit in terms of cancer prevention. So this is being researched at the moment, looking for new orthodox cancer cures coming from nature.
So how did they put a patent on vincristine?
How did they? I've no idea. Well, I guess they modify the molecules slightly from the originals. Yeah, the vinca alkaloids would be a whole range of different chemicals, and then you just fiddle with it. Plants causing cancer, tobacco, obviously everybody knows that. Comfrey is a traditional treatment of yesteryear, which can cause liver cancer. Aristolochia can cause kidney cancers particularly, and this has been a cause of problems because, as I've mentioned here, Aristolochia fungi is sometimes picked, the wrong plant is picked when you're looking for the right treatment. So difficult. Beetle nut cancer is caused by the mixing with slake lime, and that can cause mouth and esophageal cancer. I don't know anything about that American one, but potentially causing cancer. So even if we have a situation of cancer being treated, then there are also potential interactions. I've just mentioned the point there that plants contain estrogens, that estrogens can be used for hormonal purposes, and then can be alternatively interfering with the effects of treatments for certain cancers, such as prostate. I think that must be about it. I thought there was one more. So although we're aging fast, us people, we've still got a bit of hope. That's sunset on the Merici River again. I think that's my lot.
This beautiful sunset.
It is. It is. Sunrises and sunsets over the river. I do a bit of painting, and that's the sort of colours I like to get into. We're done, I think, guys. Thank you.
Very good. Excellent.
Thank you.
Thank you.